Caps are only triggered when all conditions in the algorithm are met. True false. The correct answer is false. Collaborative action plans, CAPs, are not always triggered by meeting all conditions in an algorithm. The triggering logic varies by cap and frequently includes OR operators or requires only a subset of specific conditions to be met. For example, the delirium cap will trigger if any one of the following conditions is met: the person is easily distracted, has disorganized speech, experiences fluctuating mental status, or has an acute change in mental status. Similarly, the physical activities promotion cap uses OR logic, meaning the cap can trigger if the person engages in low physical activity alongside either independent locomotion or a belief, by the person or care professional, that physical function can be improved. A resident with depression and isolation may most likely trigger which two caps? A. Falls and pressure ulcer. B. Mood and social relationship. C. Behavior and pressure ulcer. D. Prevention and activities. The correct answer is B. Mood and social relationship. Based on the RAI training materials, the mood cap specifically focuses on identifying and managing mood disorders, explicitly including depression, sadness, and anxiety. The social relationship cap addresses social withdrawal, loneliness, and isolation. The guidelines for this cap specifically note that loneliness and depression often coexist and must be treated together, and explicitly direct care professionals to treat underlying depression by referring to the mood cap. Therefore, a resident experiencing both depression and isolation is highly likely to trigger these two interconnected caps. Which factor is most important when prioritizing triggered caps? A. What the so where highlights first. B. The number of times a cap was triggered before. C. Clinical urgency and resident needs. D. What triggers most caps overall? The correct answer is C. Clinical urgency and resident needs. According to the RAI training materials, providers need to prioritize triggered collaborative action plans, CAPs, based on urgency, clinical impact, and client goals. When interpreting the CAP summary, care professionals are instructed to consider the clinical urgency and the impact on the person's quality of life, using their clinical judgment rather than just relying on automated software triggers, because not all triggered caps require immediate intervention. The physical restraints cap aims primarily to A. Increase physical strength. B. Document restraint procedures. C. Promote resident independence. D. Reduce mental stress. The correct answer is C. Promote resident independence. Based on the RAI training materials, the overall goals of care for the physical restraints cap include developing alternative care approaches and preventing long-term restraint use by reducing dependency on restraints wherever possible. By focusing on a resident's physical and cognitive abilities to reduce this dependency, the cap inherently aims to promote and maintain their independence. The other options represent different areas of focus. Increasing physical strength aligns with the physical activities promotion cap, while merely documenting procedures does not reflect the clinical, person-centered goals of the collaborative action plans. Which statement about CAP guidelines is true? A. They replace clinical judgment. B. They eliminate reassessments. C. They offer clinical guidance. D. They serve as alert thresholds. The correct answer is C. They offer clinical guidance. According to the RAI training materials, Collaborative Action Plan, CAP, guidelines provide suggested clinical reasoning steps and intervention options to assist care professionals in developing comprehensive care plans. They explicitly do not replace clinical judgment. In fact, the guidelines emphasize that because not all triggered CAPs require immediate intervention, care professionals must use their own clinical judgment to prioritize them based on the resident's specific needs and urgency. They are designed to identify areas that would benefit from further assessment and collaborative care planning, rather than to prescribe mandatory interventions or eliminate the need for reassessments. How are CAPs triggered in the RAI system? A. Based on assessor opinion. B. When patterns in data match defined logic. C. Based on random sampling. D. Manually entered by the assessor. The correct answer is B. When patterns in data match defined logic. According to the Inter-RAI-LTCF training materials, collaborative action plans, CAPs, are automatically triggered when certain patterns in assessment items are detected. Software systems utilize this defined logic, using subsets of assessment items and temporary variables, to identify problem areas where a resident may benefit from further care, support, or intervention. Residents may trigger multiple CAPs simultaneously. True, false, true. Based on the Inter-RAI-LTCF training materials, most individuals trigger multiple collaborative action plans, CAPs, at the same time, which reflects the complexity of their clinical needs. Because it is common for residents to have multiple triggered CAPs, such as clusters of falls, pain, and mood issues co-occurring, care providers are instructed to prioritize them based on clinical urgency, impact on quality of life, and the resident's goals, often developing tailored care plans that address multiple CAPs together. Who should be involved in the decision-making process after a CAP is triggered? A. Only the attending physician. B. A single care coordinator. C. An interdisciplinary team including the resident. D. Only the nursing staff. The correct answer is C. An interdisciplinary team including the resident. According to the Inter-RAI-LTCF training materials, collaborative action plans, CAPs, are designed to support and encourage interdisciplinary collaboration. Care planning following a triggered CAP should be a collaborative process that involves a team-based approach, including various healthcare professionals such as nurses, physiotherapists, and social workers. Furthermore, the guidelines explicitly state that this process must involve the individual being assessed, along with their informal supporters like family and caregivers. This is because person-centered care is essential, and the resulting care plans should be tailored to align with the resident's own strengths, preferences, and priorities. Which CAP would likely be triggered in a resident who is frequently incontinent and has a UT? A. Communication. B. Falls and pain. C. Urinary incontinence. D. Bowel conditions. The correct answer is C. Urinary incontinence. According to the Inter-RAI-LTCF training materials, the urinary incontinence CAP is designed to evaluate and address a resident's bladder control issues. The problem definition for this CAP explicitly highlights that unaddressed urinary incontinence can lead to secondary complications, including urinary tract infections, UTIs, skin breakdown, and falls. CAP triggers only include direct observation data. True, false, false. Collaborative action plans, CAPs, are automatically triggered based on patterns of data coded across the Inter-RAI-LTCF assessment. Care professionals are instructed to complete the assessment using multiple primary sources of information, which explicitly include interviews with the person being assessed, their family or primary supporters, and direct care staff, and a review of medical records, in addition to direct observation. Therefore, the data that triggers a CAP comes from a comprehensive mix of observation, documentation, and conversational feedback.